Every year in the United States, about 85,000 people suffer a heart attack. What many do not know is that some of the medications in our medicine cabinets might be raising our chances of having a heart attack. What if the painkillers or acid reflux medicines you take every day were quietly harming your heart? Would you still take them if you knew the risks? In this video, we will look at 7 common medications that scientific studies have linked to an increased risk of heart attacks. We will explain how these drugs might affect your body and why they can be dangerous. Medications work in many ways with our bodies, and the risks they pose often depend on the dosage, how long you take them, and your personal health. It is important to be aware of these risks and to talk with your doctor about the best choices for you. Let's examine these 7 types of medications one by one. Number 1. Decongestants. Decongestants, such as pseudoephedrine and phenylephrine, are found in many cold and flu medicines that you can buy without a prescription. These drugs help clear your nasal passages by narrowing the blood vessels in your nose. However, this same action can affect blood vessels all over your body. When your blood vessels tighten, your blood pressure can rise and your heart rate may increase. This extra strain on your heart may lead to problems like heart palpitations, and, in rare cases, even a heart attack. People who are sensitive to these drugs or who already have high blood pressure or heart issues should be very careful. If you take decongestants, especially if you also drink caffeine, smoke, or use other medicines that affect your blood pressure, you might face a higher risk. It may be better to use saline nasal sprays or antihistamines if you suffer from allergies. Number 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are common pain relievers such as ibuprofen, Advil, and naproxen. Many people use them for headaches, muscle pain, and other aches without much thought. However, studies have shown that even short-term use of these drugs, sometimes as little as 1 week, can raise your risk of heart attack by 20 to 50%. NSAIDs work by affecting chemicals in your body called prostaglandins, which help to keep your blood vessels working properly. When these chemicals are disturbed, your body may hold on to extra fluid, your blood pressure may rise, and your arteries might narrow. All these changes put more pressure on your heart and can make it easier for blood clots to form. If you have a history of heart disease or high blood pressure, using NSAIDs frequently can be very risky. Even if you do not have these problems, it is wise to be cautious about how often you use NSAIDs. There are other pain relief options available that might be safer for your heart. Number 3. Proton pump inhibitors. Proton pump inhibitors, such as omeprazole, lansoprazole, and esomeprazole, help reduce stomach acid to treat acid reflux, ulcers, and other stomach issues. While they are very helpful when used correctly, long-term use has been linked to a higher risk of heart attacks. Research shows that people taking PPIs have a 16 to 21% higher chance of having a heart attack compared to those who do not. One possible reason is that PPIs might lower the levels of nitric oxide, a substance that keeps blood vessels flexible and open. With less nitric oxide, arteries can harden and narrow, increasing blood pressure and the risk of clots. PPIs are also linked to lower magnesium levels, which can cause heart rhythm problems and muscle weakness. It is best to use PPIs only when needed and for the shortest time possible. Discuss with your doctor about safer alternatives like H2 blockers or natural remedies such as ginger or probiotics. Number 4. Certain antidepressants. Many people take antidepressants to manage depression and anxiety. Common types include SSRIs like fluoxetine, sertraline, and citalopram, and SNRIs like venlafaxine and duloxetine. These drugs boost mood by increasing certain brain chemicals. However, they can also reduce how well platelets stick together, which may raise the risk of bleeding and hemorrhagic strokes. This risk is higher for older adults or those with heart problems or high blood pressure. If you have heart concerns, discuss other treatment options like therapy or lifestyle changes with your doctor. Number 5. Certain diabetes medications. Some older drugs used to control blood sugar in type 2 diabetes, such as rosiglitazone, have been linked to a higher risk of heart attacks. Studies have shown rosiglitazone can raise heart attack risk by up to 43% and increase heart-related deaths by 64%. These drugs may cause your body to retain extra fluid, leading to swelling, higher blood pressure, and more strain on the heart. For those with existing heart issues, this can be dangerous. Newer diabetes medications like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists generally show better heart safety. It's important to review your treatment options with your doctor, especially if you have a history of heart disease. Number 6. Calcium channel blockers. Calcium channel blockers, such as amlodipine, diltiazem, and verapamil, are used to treat high blood pressure, chest pain, and irregular heartbeats. They work by relaxing and widening blood vessels, easing the heart's workload. However, they can also cause fluid retention, which might worsen heart failure and lower blood pressure too much. In some cases, these drugs can affect your heart's rhythm and increase the risk of arrhythmias. If you have heart disease, low blood pressure, or a history of heart failure, you should be extra careful with these medications. Sometimes, alternative drugs like ACE inhibitors or beta blockers might be a better choice. Always discuss the risks and benefits with your doctor. Number 7. Some chemotherapy drugs. Chemotherapy drugs are crucial for treating cancer, but some can seriously affect the heart. Drugs like doxorubicin, adriamycin, and fluorouracil can damage heart cells and may lead to heart failure. Studies show that up to 26% of patients on doxorubicin develop heart failure, especially when used in high doses or for long periods. These drugs produce free radicals that cause inflammation and scarring in the heart. Other chemotherapy drugs can trigger artery spasms, reducing blood flow and potentially causing a heart attack. For patients undergoing chemotherapy, regular heart tests are essential. Some treatments, such as dexrazoxane, may help protect the heart during cancer therapy. Maintaining a healthy lifestyle, eating well, exercising, and avoiding smoking can also lower the risk of heart problems during treatment. Patients should watch for warning signs such as chest pain, shortness of breath, or an irregular heartbeat. Early detection of these symptoms can help prevent more serious problems. Remember, the choice of medication should be part of an overall plan for health that includes a balanced diet, regular exercise, stress management, and avoiding smoking and excessive alcohol. When you combine these healthy lifestyle choices with careful use of medications and regular discussions with your healthcare provider, you can lower the risks. Do you or someone you know use any of these medications? Share your thoughts in the comments below. If you found this video helpful, please type yes in the comments, like the video, and subscribe for more health tips. Thank you for watching.